This is the proper procedure for the sterile ophthalmic drops that we'll be making in lab. You'll be receiving a pre-weighed bag of pilocarpine powder, 0.6 grams. You'll be receiving a bacteriostatic vial. We'll have a small beaker, our eyedropper bottle, and our 0.22 micron filter. So I have wiped down all my products. I have sprayed my gloves. So the first thing I'm going to do is I'm going to withdraw 9.4 mils from the bacteriostatic vial. Again, this is just using the basic positive pressure technique that we've been using. So I'll be putting 9.4 mils of air into my syringe. My bevel up, keeping my direct airflow. This is a horizontal airflow that I'm working in. Take my beaker, empty the contents of the bag into the beaker of the pilocarpine powder. I'm going to saturate and dissolve the powder with the bacteriostatic solution. Gently mix it. While I'm waiting for it to dissolve, I can prepare my eyedropper bottle. So you would never insert a needle into the tip of an eyedropper bottle because it will damage the plastic plus change the drop size of the bottle. So you want to ensure that that's consistent for the patient who's receiving the eye drops. So you can do one of two things. You can take the lid and gently snap back and take the tip off the bottle, or you can remove the cap, take an alcohol swab, and gently remove the tip manually, like that. And just rest it on your alcohol swab. So once your powder's been dissolved, you can withdraw your solution from the beaker, almost like an ampule. You're just going to withdraw all the solution. So if I've added 0.6 grams of powder plus 9.4 mils of bacteriostatic solution, my final volume should be 10 mils, approximately 10 mils. So I have my 10 mils. I'm ready just to insert my filter. I'm going to take off my needle, attach my filter. This is a critical site. When you open the package, this is the critical site. So you want to ensure that you do not touch the critical site. Attach the one end and you'll insert a needle to the other end. That's the other critical site. Okay. And then you're ready to filter your solution into the eyedropper bottle. Again, don't force the solution through the filter. Just gently press down on the plunger. Return your tip cap to the eyedropper bottle. Put that back on. So now you want to ensure that your filter was intact while you were filtering the solution into the eyedropper bottle. So you can do one of two things. You can try to pull down on the plunger, and you should feel resistance. You can't pull air into the filter. Also, you can draw air into the syringe, and you will not be able to push that air through. You'll feel resistance. The air will not pass through the filter. So that means your filter has been intact the whole time. If I was able to pass air through the filter, that means the filter has been damaged, and that product should be refiltered. You would receive a proper label to attach around your eyedropper bottle indicating the drug, possibly even the patient's name, and then it would be a properly labeled product.